My name is Lori Linley. I'm a student at Rock Valley College, Rockford, Illinois, and this is my informative speech, an exploration into music and its use as a medical therapy. Martin Luther once said, "My heart, which is so full to overflowing, has often been solaced and refreshed by music when sick and weary." Was his quote early evidence of music therapy? Today I will present the beginning of music, psychophysiological effects of music in clinical studies, and its use as a medical therapeutic treatment. When was music's starting point in human history? BBC News in 2012 published an article about an exciting archaeological find that may be the answer. A cave in southern Germany held the earliest of human instrument ever found, flutes, made from mammoth ivory and bird bone. Carbon dating showed them to be around 42,000 to 43,000 years old. We may not know for certain when music began, but no doubt there is evidence that music itself has been around since the earliest of human existence. Was Martin Luther a well-known theologian and religious reformer, as stated at Britannica.com, having a psychophysiological effect from the music he was listening to? More recent studies provide interesting data as to the psychophysiological effects of listening to music. One study in an article titled "Music on the Mind" by author Sharon Begley of Newsweek. Begley shares information about the music center in the brain, just behind the ear, the temporal lobes, which act as the music center of the brain. In surgery, neurosurgeons have tickled the temporal lobe region with a probe. Doing so caused the patients to hear music so crystal clear that they asked if the music was playing in the operating room. Some patients with epilepsy can be triggered to seizure when music is played. The music that triggers the seizure is dependent on the individual's trigger. For some, classical triggers seizure. For another, it may be salsa. This is one bit of evidence for the specificity when ordering music for therapy. A ScientificAmerica.com September 2001 article written by a collaborative of scientists, doctors, musicians, and mathematicians titled "How Music Can Literally Heal the Heart" speaks of physiological effects on the human heart. They state music changes our heart rates, breathing, and blood pressure and alters our heart rate variability, indicators of cardiac and mental health. Music-induced psychological, physiological changes were traced to the central node of the brain, the anterior insular. The anterior insular has heavy links to the vagus nerve, which helps to regulate body functions. In more recent times, we have examples such as the documentary Testing Mozart. At about 26.5 minutes into the production, you will meet Andreas, a severely paralyzed man. Before his accident, he was able to ride a motorcycle and play the didgeridoo. He lay fully dressed on a clinical examination table in a Vienna hospital. A pulse oximeter, an EMG, and other electrical leads have been connected to his body in order to collect data. The computer monitor displays the information collected. As his responses are monitored, the didgeridoo will be played, followed by Wolfgang Amadeus. No doubt Andreas has a positive outcome to the therapy. His eyes move as the didgeridoo is played, as well as other movements like his mouth and his tongue. It appears that his tongue is moving to the rhythm to the music. I couldn't help but wonder, is he imagining himself playing the didgeridoo? A study of 60 spine surgery patients is documented in the Journal of Clinical Nursing, February 2022. The article is titled, Music Therapy for Patients Receiving Spinal Surgery. Patients were evaluated for the effects of music therapy on postoperative pain and anxiety. Along with patients undergoing spinal surgery, others with physiological reactions to emotional or physical stress. The age range of the patients in the study are 18 to 62 years old. Anxiety and pain were of the most concern, especially for those about to have major surgery. From the evening before surgery through the second day after surgery, the experimental group listened to specially selected music, with the control group not listening to music at all. Tests such as a 24-hour urinalysis, blood pressure, heart rate, and other physiological scales were executed. A visual analog scale helped to gauge the patient's anxiety and pain levels. The journal notes the conclusion to the test results saying, music therapy has some positive effects on levels of anxiety and pain in patients undergoing spinal surgery, and complementary music therapy can alleviate pain and anxiety in patients before and after spinal surgery. Supplemental to other long-term treatments, music therapy is used to treat a host of physical and mental health issues, such as Parkinson's disease, dementia, post-traumatic stress disorder, depression, sleep disturbances, and acute treatment of stroke. Dr. Torres Theorel presents his research in his book, Physiological Health Effects of Musical Experiences. Theorel mentioned a 2006 study of percutaneous coronary interventions. 2 patient groups were used. Both groups participated in a randomized control trial, one with music and one without. 45 minutes post-op, the results is noted. The group in which music was used had less pain than the group that did not listen to music. Dr. Theorel makes clear that the music choices are not randomized. He quotes on page 55 of his book, the selection of musical pieces has to be individualized and should be based on a decision between the healthcare staff and the patient. Today, I presented the beginning of music, psychophysiological effects of music in clinical studies, and its use as a therapeutic treatment. Like any medicine used as a medical treatment, it needs to be specific and well managed. Music therapy can be used to treat non-life-threatening conditions such as anxiety and to more severe life-threatening ones like coronary surgery. Scientific data shows that music therapy is a useful tool in the healthcare medicine cabinet. Thank you.